Hello, my name is Kelly Mills, and I'm a neurologist at Johns Hopkins specializing in movement disorders like essential tremor, Parkinson's disease, and other movement issues. I lead the Neuromodulation and Advanced Therapies Clinic, where we use treatments like MRI-guided focused ultrasound, or FUS, to treat movement symptoms that are refractory to other therapies. I'd like to tell you about one of my patients who received focused ultrasound for treatment of his tremor. My patient was an 80-year-old man with long-standing essential tremor that began in his 50s, but that worsened considerably over the last 10 to 15 years to the point where he had difficulty performing activities of daily living independently. He reported difficulty brushing his teeth, signing his name, eating, and drinking. He was dependent on his son and grandson to help him with many activities because of the tremor. He also reported some imbalance while walking. He had started on primidone about 10 years ago, which helped initially, but then had a waning effect as the tremor worsened. He also had initially found benefit in the postural tremor with the addition of gabapentin, but the tremor continued to worsen and affected ADLs during movement. When I met him, he was taking 100 milligrams of primidone twice daily, combined with 300 milligrams of gabapentin in the morning and 600 milligrams of gabapentin in the evening. The patient does have diabetes without great glucose control, and there was some concern that propranolol could worsen control of his blood glucose. In addition to diabetes, the patient had a significant cardiac history with multiple stents. On examination, there was no clear Parkinsonism such as clear rigidity or bradykinesia. He had normal oculomotor function and speech without evidence of substantial cerebellar dysfunction. He had postural and kinetic tremor between 3 to 5 centimeters of amplitude bilaterally that was present with most tasks. There was worsening with intention to write, and he was unable to write anything legible. His neuropsychological evaluation revealed a suspicion for baseline learning disability that affected results, but no clear global cognitive disorder that would impact decision-making around advanced therapies like DBS or FUS. He did have long-standing, mild generalized anxiety disorder. We discussed treatment options for his medically refractory tremor at our Advanced Therapies Conference, with representatives from neurology, neurosurgery, neuropsychology, and nursing present. It was felt that with his advanced age, diabetes, that might complicate wound healing and anxiety, thalamic-focused ultrasound would be advantageous over deep brain stimulation or other treatments. The decussating and non-decussating dentatorubral thalamic tracts were isolated on his pre-procedural MRI using tractography, and a target was set at the intersection between these two tracts in the VIM region of the thalamus. 2 test sonications were performed and tremor improved. He then received 3 treatment sonications, with a third sonication being performed 1 millimeter higher in the lateral position. When I saw him 22 days after the procedure, he reported a substantial improvement in tremor, allowing him to be independent in several more ADLs, including eating with a spoon and drinking from a glass of water. He had 1 to 2 weeks of worsened balance, requiring him to use his walker a bit more often when walking in the house, but he felt back to baseline at the time of the first follow-up visit. He did not experience any change in cognition, and his mood was initially lifted in light of the tremor reduction. His objective measure of tremor, the TETRAS performance scale, reduced from 33 to 24 out of 64, and his ADL score, representing the impact of tremor on his ADLs, went from a 39 down to an 11 out of 48. This was sustained at a 6-month follow-up visit. He was very happy with the outcome because it allowed him to be less dependent on his son and grandson for tasks around the house. He said that he would have done it again and would like to consider treatment of the contralateral side. He was so appreciative of the improvement in tremor that he was enthusiastic about me sharing his story with you today.